Good afternoon. This is the 2-minute warning. Please press 1 to ask a question.
Good afternoon, everybody, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we have 266,136 cases, 2,253 new cases reported since yesterday, 1,193 people in the hospital, and sadly, 4,245 North Carolinians who've lost their lives. We remember all of those that we've lost, and we keep them and their families in our prayers. North Carolina is seeing high case counts and hospitalizations from COVID-19 as this virus continues spreading throughout our state. We know large gatherings can spread this virus rapidly, particularly when masks are ignored. But importantly, contact tracers are finding that many cases come from smaller gatherings of extended family and friends, youth group outings, family meals, church. We too often let our guard down when we're with people we know and trust. But knowing and trusting doesn't stop the virus. Today, we need people to hear us loud and clear. If you're gathered with anyone who does not live in your household, you are at risk, and they are too. Wear a mask and practice social distancing. Many people can have the virus and don't know it. It doesn't mean you don't trust each other. It means you care about each other. As the pandemic continues to affect our way of living and working, many families are facing difficult economic times. 2 weeks ago, we started our NC Hope initiative. This provides renters who are at 80% or less of the median income of a county with up to 6 months back rent and utility payments. The money is paid directly to their landlords and utility providers. It ensures renters can stay in their homes with the lights on. As I looked at the more than 23,000 applications that we received in less than 2 weeks, I thought about how each one of those applications represents a family on the edge having to make hard choices. I also thought about how many families still face eviction. Some are able to seek protection under the current Center for Disease Control, the CDC moratorium, preventing evictions for certain people. But there's a lot of confusion with landlords and tenants and the courts. Therefore, today, I've signed a new executive order to prevent evictions in North Carolina for people who can't afford the rent. The Council of State has concurred. Roughly 300,000 to 400,000 households across North Carolina are currently unable to pay rent. Without today's actions, almost 250,000 eviction filings could be submitted by January of 2021. Many families are trying to do the right thing. They're having to make tough choices, but this virus has made it difficult. Today's order also builds on the CDC's federal eviction moratorium. It requires landlords to ensure tenants are aware of the CDC protections and how to claim them. This order makes it clear that the CDC moratorium applies to all eligible North Carolinians, not just those who live in federally subsidized housing. And it ensures that the recipients of North Carolina's HOPE program are still able to qualify for these protections. The result during this global pandemic will be more North Carolinians staying in their homes, more landlords getting paid rent, and fewer utility companies shutting off the power. That's a good thing. Our NC Hope initiative remains available to assist families with rent or utility payments. You can access it by calling 211 or visiting nc211.org/hope. As we grapple with this pandemic, let's remember that our economy will only be as strong as our efforts to stamp out this virus. A recovery depends on elected officials and everybody else taking this virus seriously and doing our part to prevent the spread as we work toward a vaccine and more effective treatments. I believe a safe and effective vaccine will come and that treatments for those who get sick will get better. In the meantime, let's save lives and make our economy stronger by wearing a mask, washing your hands, and waiting 6 feet apart. These actions are simple, but effective. And if we all do them, even with extended family and friends, we can get through this. Let's keep taking care of each other and let our resilience take center stage. There is light at the end of this tunnel. Now I'd like to ask Dr. Mandy Cohen, our Secretary of the North Carolina Department of Health and Human Services, to share her update. Dr. Cohen?
Thank you, Governor. As we approach the end of October, we and many states and countries around the world are losing ground on the progress we had made. Here in North Carolina, our cases and hospitalizations continue to trend up, and the percent of tests that are positive is creeping higher. It's not all bad news, though. We are seeing what is possible when we work together. We've seen a significant decrease in clusters reported in October in places like food processing plants and construction settings. This has taken continued partnership, commitment, and hard work across government agencies, community organizations, businesses, and employees. What is worrisome is the increase in cases associated with clusters in religious and social gatherings. Let's work together to protect our family and neighbors in these settings. Meeting virtually is always best, but I understand people want and need to be together. So if you do meet in person, please take steps to keep everyone as safe as possible. Keep any gatherings small. Hold them outside if you can, or open a window to increase ventilation. Arrange the space to maintain social distancing, especially when you're eating or drinking. Wash your hands a lot. And importantly, wear a mask. And it's not about how well you know someone. We need to wear a mask anytime we are with people who don't live with us. And as we look forward to Halloween this weekend, we know holidays have been an opportunity for this virus to spread. We can celebrate Halloween this weekend. We just need to do some of the lower risk activities. I am planning to do a trick or treat scavenger hunt with my girls at a nearby park. And I'll also lay Halloween candy out on a large table outside our front door. That way, no one has to dig their hands into a candy bowl or even ring our doorbell. We have guidance on our website, covid19.ncdhhs.gov, with ideas on how to have fun this Halloween while minimizing risk. Remember, key to our efforts to slow the spread of this virus and protect our friends and neighbors is wearing a mask. Beginning next week, we'll be airing a new ad that reminds everyone that the decision to wear a mask is not about who you know or how well you know them. It's going to be airing in English and in Spanish across the state. So let's take a look at that new ad right now.
Deciding when to wear a mask isn't about who you know or how well you know them. Just ask yourself, will I be with anyone I don't live with? If the answer is yes, get behind the mask. Help slow the spread of COVID-19. Get behind the mask. Learn more at covid19.ncdhhs.gov.
We can learn how to live with this virus, but living with it doesn't mean ignoring it. Living with it means practicing those 3 W's: wearing a face mask, waiting 6 feet apart, and washing your hand. So whatever your reason, get behind the mask. Thanks, Governor.
Thank you, Dr. Cohen. We continue to appreciate your good work. That PSA shares a strong message for how we can take care of each other right now. We've got a storm maybe heading our way. So next I'll ask our Director of Emergency Management, Mike Sprayberry, to share an update about the weather. Mike.
Thank you, Governor, and thank you for your leadership. Good afternoon. Today is day 233 of the State Emergency Operations Center's COVID-19 response. The State Emergency Response Team continues to push PPE out and made deliveries to 50 counties yesterday. The Unified Command continues to meet daily to discuss tactics, develop, and execute strategies for COVID response. As the governor said, we do have bad weather coming our way. Hurricane Zeta will make landfall in southeastern Louisiana later today. The system will then quickly move northeastward, bringing periods of moderate to heavy rainfall, gusty winds, and the chance of severe storms to portions of North Carolina. Our concerns are primarily for western North Carolina, as they will experience heavy downpours leading to localized flash flooding. There is a tropical storm warning as well as a flash flood and high wind watches already in effect for much of western North Carolina. Impacts from gusty winds will be felt statewide. We're likely to have sustained winds of 20 to 30 miles per hour with gusts up to 30 to 45 miles per hour. The strongest wind gusts will begin in the mountains during the early morning hours and spread towards the northeast by late morning and early afternoon. Downed trees and power lines are possible, especially across western North Carolina, where saturated soils will weaken trees. The mountains of North Carolina could see 1 to 4 inches of rain through tomorrow, with isolated higher totals in excess of 4 to 5 inches. While the greatest impacts from the remnants of Zeta will likely be across western portions of our state, central and eastern North Carolina will still see gusty winds and could see isolated severe storms tomorrow afternoon and through the evening hours. The severe threat may increase after sunset, so it's always important to have multiple ways of receiving severe weather alerts when storms are possible overnight. Gusting winds could also lead to soundside flooding along the Outer Banks. Our county partners are tracking this system closely, and they're prepared to respond as needed. We're also staying in close contact with them to ensure the state can provide resources upon their request. As the remnants of Zeta impact our state, please visit drivenc.gov for the latest on any road closures. In closing, just like the governor said, and just like Secretary Cohen said, we want to remember that whatever your reason, now is the time to get behind the mask. Wear, wait, and wash. This is how we slow the spread of the virus. It works. As always, don't forget to look out for your family, friends, and neighbors, and to call your loved ones daily. Guaranteed they'll appreciate it. With kindness and cooperation, we'll all get through this together as one team, one mission, and one family. Thank you, Governor.
Mike, I continue to be grateful to the men and women of the Emergency Operations Center who are working here together every single day on COVID-19, also with other disasters that might hit our state and our county partners across the state. It's a great working relationship, and we appreciate your leadership, Mike. Also with me today is Monica McGee and Brian Tipton, who are our sign language interpreters. And behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We'll now take questions from the media, and if you can give your name, your organization, we'll take the first one.
Our first question is from Cole Del Charco with WUNC.
Hi, Governor. Thank you for taking my question. This is Cole Del Charco with WUNC. Just wondering, as COVID-19 cases are spreading, even more throughout North Carolina, how are we doing on getting more testing supplies out to local health departments?
We're continuing our efforts to provide more widespread testing. Some of the tests that we've just received from the federal government, we have shipped to schools and nursing homes. And we know that testing is a key to making sure we slow the spread of the virus. One of our challenges right now, we've got a lot of testing supplies and a lot of places to go. More and more people are hesitant about being tested. And we're encouraging people that if you think that you may have been in a situation where you may have been exposed, we want you to go and to get tested. It's so important. I'll let Dr. Cohen address that as well.
Hi, Cole. Thanks for the question around testing. We are actually testing at some of our highest rates that we have throughout this pandemic. And we continue to make sure that there are free testing events across the state. We have about 200 events coming up in just the next 2 weeks. We encourage folks to go to our website where you can see over 600 sites, as well as 200 of those being free events across the state. In addition, as the governor mentioned, the federal government has shipped to us some of the new rapid Binax Now antigen tests. These are slightly new and different kinds of tests than we've used in the past. We have used a mechanism to make sure to get those out to our local health departments. So they already do have those and are using those in various settings where we see outbreaks and others. So we're doing a fair amount of testing. But again, as the governor said, we want to make sure anyone who has symptoms or thinks they may have been exposed to COVID-19 to go get a test. Thank you.
Next question, please.
Our next question is from Kate Martin with Carolina Public Press.
Hi, Governor and Dr. Cohen. This is Kate Martin with Carolina Public Press. In 4 short weeks, we are going to come upon the holiday season where lots of people travel and gather together to observe their traditions. I'm wondering, I have 2 questions. If you could, please share with us your family's Thanksgiving traditions and how that might look differently this year. Also, how do you think people can maintain their Thanksgiving tradition while living with this virus? Thank you.
Well, thanks for that, Kate. These are hard questions. I heard Dr. Francis Collins the other day, the head of the NIH, who talked about his family tradition was having a large family gathering every Thanksgiving. And apparently they had done it for decades. And they'd made the decision, because they loved and cared about each other, that they were not going to do it this year. And everybody was going to stay home with immediate family, and they were going to try to Zoom and get together and in that way. We've had traditions of getting together with broader extended family throughout Thanksgiving. This year, my family's just going to have our children and Kristen and me and the animals. And we're doing that in order to make sure as much as possible that everyone is safe as possible. And I would recommend that people look at this, look at the people who are vulnerable in your family, realize that hopefully next holiday season we'll be out on the other end of this. And this is not going to be forever. We're not going to be forever in this valley. We're working very hard. People are doing amazing research on vaccines and therapeutics here. And, I believe that we're all going to pull together more and do what we need to do to slow the spread of this virus. And, you really have to analyze this and think about what's best for your family in particular. So I'll let Dr. Cohen go into that as well.
Hi, Kate. Thanks. Really important topic. Obviously, I'm looking forward just to this weekend and the holiday. I want to bring folks' attention to our guidance related to Halloween, since it's this Saturday. And there are ways for us to celebrate Halloween with lower risk activities. And I think you're going to see that we will put out additional guidance for Thanksgiving specifically. But we already have guidance related to social gatherings on our website. And it's some of the things I mentioned in my remarks, right? We know people want and need to be together. And if, again, we would love for you to do that virtually, but if you're going to come together, keep it small, keep it outside, make sure that you're being physically social distance if you are together. Make sure you're washing your hands often. We even have guidance on how to serve food and such to lower risk. So we hope that folks will take that guidance and use it well, and do look out for some additional guidance from us specific to Thanksgiving. But as you look forward to Halloween this weekend, know that we have guidance as well for the holiday coming up very soon. Thanks.
Next question, please.
Our next question is from Derek Dellinger with Fox 46.
Yes, this is Derek Dellinger with Fox 46. I have two questions for Dr. Mandy Cohen, and it actually revolves around one case specifically here in Mecklenburg County. Actually, it's a cluster, 150 cases with the United House of Prayer. Are there any indications that this extends outside of Mecklenburg County? Because we know that there were a lot of attendees at that event, specifically that we've been told at least that were not in Mecklenburg County, that come from other parts of the state, also other parts of the country as well. And how common are these events, these religious associated clusters starting to show? The second question I have specifically has to do with the reopening of schools. How are these rising cases kind of affecting the decision making in regards to at least what's being done on the DHS front, at least as far as the guidance is concerned?
Great. Thanks for those questions. Let me start with the United House of Prayer and the cluster, the quite large cluster that we saw, and that is in the Mecklenburg area. I think you're exactly right in saying that it wasn't just Mecklenburg, that there were folks from other counties and from other parts of the country. I know the Mecklenburg local health department has been working on doing that contact tracing and making sure that there are other congregations in different parts of our state. And so we have alerted our other local health departments to make sure that they are proactively reaching out to make sure that we are containing any further spread of this virus. We are seeing further spread of the virus in religious settings. We did post some new information about clusters in various types of settings on our website starting last week, so you can can see that there. And you can see the number of clusters in religious settings has been going up. And as I mentioned in my remarks, there are ways for us to gather more safely. Keep it small, keep it outside, wash your hands, be socially distant. So those are the things that can keep us all safe and keep this virus spread low. As far as schools, again, this is something that we continue to look at our metrics and our data. I know a number of schools are going back in person. My kids will be back in school here in Wake County starting next week. And again, this is about making sure that we are doing the safety protocols that are included in the guidance, no matter how the school is deciding to go back in person. Everyone needs to wear a mask all the time. You need to social distance. You need to do the screening protocols. So again, I think if we can focus on that, you will also see on our dashboard that we report out clusters or in school settings as well. So I think if we're focusing on the things that keep this virus level low, that we will continue to be able to have kids be in our school buildings. Thanks.
Next question, please.
Our next question is from Thomas Waybrick with WITN.
Hi, Governor. Thanks for your time. This is Thomas Waybrick at WITN. Phase 3 has more or less coincided with both campaigns picking up steam and making more visits to North Carolina. So it's hard to determine whether it's the bars or these rallies that have contributed to a rise in case counts. Has the state definitively linked any case outbreaks to these political events? And if so, will any changes be made to keep those events from spreading in the next few days?
We are concerned when there are any large gatherings, particularly when people stand together, not socially distanced for long periods of time, and when they're not wearing masks and people usually coming from all over the place. I do know that there's a lot of work that goes into contact tracing, but that particularly people feel sometimes uncomfortable talking to contact tracers that are trying to find where things came from. And I know that there has been some real hesitancy by a number of people to talk to contact tracers about where they may have gotten the virus. So what we're going to do is to continue to push. I'm really concerned about campaigns that flying all over the place and come into North Carolina, hold these large events, gathering a lot of people together, also bringing people in from out of state, and then leaving. And we know 2 to 3 weeks later, oftentimes, you see spread that occurs, infections that occur. And we are particularly concerned about our rural areas where hospitals are a little bit thinner and it's more difficult for them to be able to accept a lot of patients. And I know Dr. Cohen and her team have been on the ball checking with all of the hospitals, but we're at that point right now where we potentially could see some spikes like we've seen in other states. So we want to continue to push the rules that we have and to encourage people to do better. And you know, it is very frustrating when they're holding these events and then leaving, and North Carolina residents are going to have to deal with this aftermath. Dr. Cohen.
Hi, Thomas. Just a few other things to add. What we're seeing on our cases now, it's not one setting, one demographic, or one location. As the governor said, we are seeing higher cases in our rural areas. We are seeing more cases amongst those who are white. So those are some of the trends we're seeing. I would not say it's any one thing related back to phase 3. I think as we have seen temperatures go down, humidity go down, this virus is just able to spread more. We are seeing social gatherings, religious settings be places where this virus is spreading. It just reminds us that we have to be vigilant in all places that we are, whether we're with extended family, anyone who is outside our home. We want to be doing those 3 W's, and of course, avoiding large events where folks would be gathered together without masks and close together. Thanks.
Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with the NNO. Thanks for taking my question. I want to follow up on the previous question. So have contact tracers not identified any of these gatherings that have been related to cases? And then also, Governor Cooper, I understand you got the White House Coronavirus Task Force report yesterday. Was there anything in there that's new or different that that we don't already know, or that'll change things going forward?
We've continued to review the White House Coronavirus Task Force report every week, and we make responses to it. I just wish that the leaders of the task force and the elected officials would abide by it. It would help a lot, but I'll let Dr. Cohen address those other issues.
Hi, Dawn. As we've talked about related to contact tracing, we've been doing a ton of contacts to folks as we've had some of our highest days of cases. We've had historic high day of cases over the last number of weeks, which means a lot of folks to be contacted. And what we're seeing is about the same trends that we have been. About 50% of folks, yes, it's a fly. Yes, 50% of folks, we can't actually determine whether or not we know exactly where they contacted the virus from. So about half of folks either don't respond to us at all, or when we talk with them, we can't isolate exactly where they have picked up this virus. What we know, it's in our communities. It is, as I'm saying, it is in all of our communities and all spaces, which is why we have to be vigilant across the board.
Next question, please.
Follow-up, Dawn Vaughn, News and Observer.
Just a follow-up again on the task force report. So is there any new information that we should know that hasn't become public yet? And will there be state enforcement of the new executive order about evictions as far as landlords?
Hi, Dawn. I'll do the first part on the White House Task Force report. I was just reviewing it before this. And again, it's very consistent with what we've seen in the past. It continues to reinforce that we need to be vigilant on all the things we've been talking about. It continues to point out that our cases are higher in our rural areas. It points to a number of counties that we can see on our dashboard as well. You can see it going to our dashboard right now about some of these counties of concern that have higher levels of viral spread. They are in more of our rural counties. So that is where we are going to focus. Again, they also point out social gatherings, religious gatherings as places where we really need to focus our attention. But again, I think it's in line with what we've been getting in terms of recommendations from them all along. We all just need to work hard at that, and I'll turn it back over to the governor.
And as for the order on evictions, we certainly hope that landlords will obey this order. Many of them have obeyed the CDC order that's in effect, but there's a lot of confusion about it. So this order puts it in place. And then if any landlord would file an eviction claim in violation of the order, we hope the court would recognize that and delay the action until the order has expired. The good thing about all of this, though, is that we do have this HOPE initiative, North Carolina HOPE, that is providing money right now on behalf of people to landlords and utilities. And this is going to reduce the number of evictions itself. This order will help to stop things right now, and we can enter into these agreements and can get these back payments made and try to get people back on their feet. Also, if we can get people pulling together to wear masks and social distance and slow the spread of this virus, it'll help us pick up our economy and do the things that we need to do to move us forward. But we look forward to continuing to try to help. There are a couple of other efforts going on too. There's some CDBG money that the Department of Commerce is working with local governments to help with rent and utilities. We're helping out small businesses over in Commerce with the MERS program. A number of historically underutilized businesses have begun receiving some additional help. And we continue to hope and to push that at some point soon, Congress and the President will come together and provide one more relief package for the states, cities, our schools, people who need help right now. Thanks. Next question.
Our next question is from Reuben Jones with Spectrum News.
Hi, good afternoon. This is Reuben Jones from Spectrum News in Charlotte. I wonder, as you face these historic high days that you talked about, what specific metrics are you looking at? Because different things over the past 6 months have been more concerning over another, whether it's hospitalizations or is it the increasing positivity rate to figure out whether new restrictions need to be put in place?
Well, thanks. And we look at a certain number of metrics. We look at the number of positive cases that we have. We've been more successful in testing, so we know that we're going to have more positive cases. But we also look at the percent positive, and we know we want that to be around 5 or lower, but we've seen it creep up to 6 and even 7 during this period of time. That's concerning, not into double digits or 20s like you're seeing in some states, but that number is concerning. We also monitor our hospitalizations. They have continued to creep up. We have plenty of hospital capacity, plenty of ICU capacity, plenty of ventilator capacity, but you are concerned when you see it creep up. And Dr. Cohen continues to be concerned about some of the smaller hospitals that are already feeling a little bit of the pinch here. And, we'll look at where our testing is, our tracing is in the middle of all of this to make determination on what steps that we take next. We already have made determinations to stay in phase 3 right now, but also to work more on enforcement, work more with local governments on making sure that we're spreading the word about how important it is to slow the spread of this virus. You want to add anything to that, Dr. Cohen? Okay. Next question, please.
Follow-up, Reuben Jones, Spectrum News.
Secretary Cohen, I just wanted to follow up on the number you mentioned before. About half of the cases you're having trouble pinpointing where that person got the virus through contact tracing. That's been a problem with so many counties with contact tracing. I wonder how often people that your tracers are talking to, they refuse to give the information or are just ignoring the request from the tracer. Thank you.
Ruben, thanks for that. So when we are doing contact tracing, as I said, I think we had more than 70,000 contacts just last week alone with folks. So folks are picking up the phone, and thank you for that. But we definitely know we are still missing a chunk of folks. And even when they do pick up the phone, folks, as the governor has mentioned, are hesitant to give that information. So want to remind folks that it is confidential information. We never share that with another contact. Folks make it feel like, oh, I'm telling on a friend that I might have been near. But it's really important for us to track this down so we can get ahead of this virus, make sure folks know to get tested, know to stay isolated. There are also new programs that we have in addition to the help related to evictions and rent payments. We have some programs, particularly in some of our hardest hit counties, where we offer wraparound services to make sure that folks can stay home. We know that it is hard to get tested and then stay home if you are positive, because if you're missing work, that's really challenging. So we are trying to do everything we can to make it possible for folks to get tested, to work with our contact tracers so we can get ahead of this virus, keep that virus level low, again, so we can continue to make progress here in North Carolina. Thanks.
Next question, please.
Our next question is from Richard Craver with the Winston-Salem Journal.
Hello, Governor. This is Richard Craver with the Salem Journal. I've got one question, I guess, for you and one question for Secretary Cohen. At this point, it's been about a week since y'all put out a recommendation to local communities, local authorities, to consider tighter restrictions than the state is doing in terms of social gatherings and bars and things like that. I was wanting to see what kind of response have y'all seen so far and how much of that response has fallen along political lines. And then the second question is, how much of a factor do you feel like that people still having a disbelief that there's either a COVID virus out there or is still some sort of belief that it's a hoax that leads people not to adhere to the 3 Ws and efforts to try to limit the spread?
I heard a saying a few days ago when somebody had a mask is not political, it's patriotic. overwhelmingly, scientists say that the way to slow the spread of this virus, one of the best ways, is to wear a mask and social distance and make sure that you're washing your hands frequently. So we believe that maybe, hopefully, and I've said this a number of times from this podium, once we get past this election, I think that can help us in our battle to slow the spread of the virus, because I think we'll find more people not using the political excuse, but more and more people who would be willing to follow science and do the things that we need to do to slow the spread. We know that our local communities, many of them are working hard. Dr. Cohen is working closely with them, as are our staff. Some people are analyzing what they can do. Others have stepped up more with enforcement, both informally and formally. But I'll let Secretary Cohen talk to you a little bit about what's been happening since that letter she and Secretary Hooks sent.
Thank you, Governor. Thanks, Richard. As part of that letter and our ask to about a third of the counties where we were seeing our highest levels of viral spread, we asked them to do two things. One was certainly on the enforcement side, but the other was to work with us in a positive way to make sure to promote the 3 Ws and to work with their local businesses, work with faith leaders to make sure that we're raising the profile of concern in their communities, and also to remind folks that there's things we can do right now to make sure we're keeping virus level low. And on that side, I have definitely seen a lot of increased work at the local level where they're using social media, they're working with their business communities, working with faith leaders to make sure that we are doing all the things we can right now to slow the spread of the virus. I've also seen our local public health departments and others continue to step up their efforts around enforcement, and we work closely with them in that. And again, I think if we can all focus on the things that work, that science tells us that slow the spread of this virus, that is a way that we can hold down this spread of this virus, and we can all live with this virus. Thank you.
Next question, please.
Our next question is from Jonah Kaplan with ABC 11.
Good afternoon, Governor Cooper, Dr. Cohen, Director Sprayberry, Jonah Kaplan here with ABC 11. So in the past, I've asked you about what we can aim for in terms of metrics, something we can work towards, like if we reach 5% cases or below, you'll ease restrictions on bars or something. So now I'm going to ask the inverse. What's the threshold for moving backwards? Is it 8%, 10%, 12%? Will you give North Carolinians something tangible to understand your decision-making? And what will moving backwards look like?
Well, first, all of these metrics are interactive, Jonah, and we want to make sure that we're looking at all of them before making decisions on what we need to do next. We're looking forward and hoping that we don't have to go backward, because when we look at efforts that we can do positively together, when we look at enforcement efforts, both at the local and state level, we hope to be able to see a slowing of the spread. And we have not seen a spike of this virus here like we have in other states. So I'm feeling positive that we can attack this thing with the tools that we have. We are also having more of a focus locally, understanding that there are certain areas that are seeing more spread, and this is why we're working with them. And we may look at more objective, where we're looking at all of it objective. We let more specifics in some of these local areas. But I know Dr. Cohen has been talking to some of them about that, and I'll let her say a word or two about it.
Hi, Jonah. I think the governor's exactly right. We're continue to look at all of our metrics. They interact with each other differently. And so there haven't been exact cut points that we have put out in order to make those decisions. I think it has allowed us as a state to avoid both of the major surges that we've seen across the country. We avoided the surge the Northeast saw. We avoided the surge the South saw. And I'm hoping we, again, can avoid the surge that the Midwest and, frankly, some of our Southern state partners are seeing again. So we're going to focus on our efforts. And this is why I think it's really important that we continue to get out the messages around the 3Ws, specifically helping folks understand that social gatherings, religious settings are places where this virus is spreading, making sure to wear the mask when you're around anyone who's outside your home. So those are the things we'll focus on. And again, hard to give exact cut points because, as the governor said, these metrics interact with each other, and we don't want to have to move backwards. That's always been a possibility. We've always said that. We'll continue to watch our metrics before we would make any decision. Thanks.
Next question, please.
Follow-up, Jonah Kaplan, ABC 11.
Thanks very much for taking a second question here. I know you've talked about your concern. There's potential when you have these political rallies, but I want to ask, is there evidence of spread? It's been a month since a rally in Winston-Salem. It's been several weeks since a rally in Greenville, in Fayetteville, and now a week since Gastonia. Is there evidence of spread? And if not, what does that say about other big outdoor events, which could also include college football games? Thank you.
Well, there's evidence of spread over our state, and we're seeing it concentrated more in rural areas, and we're seeing it concentrated more in the white population. So we are seeing spread, and there is no way that large gatherings over long periods of time with people standing together, there's no way that that helps things. And so I'll let Dr. Cohen say a word or two. I think she's got, I mean, there's that it's not a good thing. And what we need right now is the opposite. We need people taking responsibility because we're continuing to see this spread. Most of the things that cause community spread aren't tied to any specific one event, because that's the very definition of community spread. I mean, they're just, these contact tracers can ask a lot of questions and people can give them a lot of answers, and they just simply may not be able to determine exactly where the person got it, even if they cooperate. A lot don't cooperate. A lot won't answer the phone. A lot of them, when they do, won't answer the questions. But even when they do, it's often difficult to find where they got it because we're in the midst of community spread. And that's why we've got to come together to fight this thing every step of the way. Next question, please.
Our next question is from Katie Peralta with the Charlotte Agenda.
Hi, Governor. This is Katie Peralta with the Charlotte Agenda. This is a similar question to the previous one, but is there any possibility, based on the direction of the data, that there will be tighter restrictions in North Carolina moving forward? And what could that look like in terms of business restrictions, capacity limits, potentially reversal of, the opening of some business, et cetera?
We've made the decision to stay where we are in the current phase, and we will look to see what the problem is, where the problems are, before making decisions about going forward. Our idea is that we want to go forward here, and we want to make positive progress. And we believe we have the tools in place to try to make sure that we do slow the spread of this virus. So we don't have plans to go back. And when this virus continues, if it continues to go upward and we start seeing spikes, then we have to see where the problems are, what the problems are, and then make a decision based on the science and the data as we have from day one. You got anything to add to that? Okay. Next question, please.
Our final question today will be from Jody McCreary with CBS 17.
Yes, thank you for taking my question. I wanted to revisit, you both mentioned the increase in cases in the rural areas in the state. And I was just wondering if you had an explanation or any insight into why that might be.
Dr. Cohen, address that.
Hi, Judy. Thanks for that question. We are seeing spread in our rural areas, and it actually mirrors a lot of the spread we're seeing across the Midwest. I think it is we've been talking about, the informal social gatherings as well as some of the religious settings that we're seeing some of the spread. But I think it is making sure that we know that this virus is not just something that's happening in our urban areas of the state. It is happening in our rural communities. You can visit our dashboard. It gives you a very good picture to understand where is this virus spreading by population. So not only just the total number of cases, but you can actually go right now and you can cut that data by population at the county level, so you can see for yourself about where that virus is spreading. But this virus spreads when people don't do the 3 W's. It's that simple. If you're gathering together, particularly in larger groups for a longer period of time without a mask, this virus spreads. Particularly as we get into the winter months, it's even more hospitable for this virus to spread. So what we want to make sure is that in all settings, folks are doing those 3 W's. We know this virus spreads when you're not doing the 3 W's. So let's all do this step together where we can protect each other, and we'll be able to, as the governor said, continue to make progress. No one wants to go backwards. So let's all work together. Thanks.
Thank all of you for being with us. Continue to practice the 3 W's and have a safe Halloween, everybody, this weekend. Thank you.